Hi guys, it's nighttime already. I look really bad right now, so don't, please ignore me. But I wanted to get on. I have a lot of people texting me, and again, it's just a lot easier for me to do a quick follow-up. So, follow-up is, yesterday the neurosurgeon came in to see Brian. She actually said that the pathology doctor felt like she was actually being pessimistic, and they feel like she got 100% of the one tumor. So that was a win. They feel like what she was seeing in the MRI was actually just the hematoma and the blood that was left over from surgery. So that was some good news for us. So as far as we're aware, he just has the one tumor now that is located in his motor cortex. A lot of people have said why they didn't try and take that out. That was actually, she said she'd be happy to go after that, but she also told us there would be a lot of, because it's in the motor cortex and all those vessels and everything, that he would be super weak in the legs or even paralyzed. And we decided that we would not do that, that we would wait for chemo and radiation. We saw oncology on Sunday. They came and talked to him. He seems to be in better spirits today. Sunday was really hard. I think actually speaking to oncology was obviously overwhelming. The diagnosis that they're thinking that he has, which is that it actually is glioblastoma, which is non-curable according to the medical world. Most people are about 14 to 18 months is what they give them. And even if they can get rid of a tumor, it's 100% return rate. I think I've said that before, but now the patho said that she was wrong about the not getting the full tumor, so maybe they're still wrong about what type of tumor he has. So we're also crossing our fingers on that. We have an appointment tomorrow with his primary care physician. His thyroid was a little off, so we're getting that tested. And then Thursday we're seeing the oncologist for his chemotherapy. And then next Tuesday I actually just got a call from his radiology oncologist, and we will meet with them on Tuesday to kind of make a plan. Now, also with that, I know a lot of people know that I'm more holistic. Again, I said that I'm going to start him on vitamin C. We did come home yesterday, and he just said he was really tired of being poked, so I didn't give him another IV yesterday for the high-dose vitamin C. I was going to start that today, but it may actually be tomorrow. I am back in my office tomorrow and have a very back-to-back schedule tomorrow, so I'm hoping that he's coming with me because I can't leave him at home alone. So he'll be in the massage chair. We'll be using the red light and everything else for him as well. And I may have to have my kids or somebody running home to take a nap or whatever is needed. I really can't leave him alone at this point. He's very sharp. I mean, even right after the surgery, he got on and submitted time cards, and he's texting his workers and stuff. But like one night he texted one of his workers at like 2 o'clock in the morning. So there's he would never do that normally. So there's a little bit of difference in his, or thinking skills a bit. He couldn't remember how to preheat the oven. Daily tasks, sometimes he gets kind of fixated on something, washing his legs or feet or whatever, and it just doesn't all correspond. But otherwise, I mean, you wouldn't know. Most people wouldn't even know that there was an issue. It's just these little nuances that we see. He woke up last night, which makes me nervous because he gets up and down and is doing stuff on his own at home because we're at home. But he laid flat last night, and he woke me up at about 3 o'clock saying that he had a really bad headache. And I'm like, why did you lay flat? But you know, that's not something that I can say to him because he doesn't remember. He doesn't know why he can't lay flat. He just knows he normally lays flat. And I didn't catch that he had lowered his bed because he was asleep before I went to sleep, and he was up. I actually had to take the phone out of his hand because he had fallen asleep with it. So, but otherwise he's doing well. He can walk, talk, all the things. There's just these few little things that, like I said, if you were just to sit here and talk to him, you probably wouldn't even notice. They do feel like this will get better over time. Obviously, he just had a huge brain surgery and had a tumor taken out of his brain in the area of the corpus callosum, which is where, you know, tasks and thinking and all that stuff is. So that will get better. It's actually kind of, sometimes I write down little things because Brian is he's so I don't know, he's so clean. He's so, I mean, he was in the Army, so he folds his pants and socks and stuff like that a different way, and it's really cute to me that he'll leave cupboards open and he'll leave drawers open, and he, you know, things that you know he would never do. He'll close the pantry light or the door and the light's still on, and he would never do that before. And so, and he doesn't really hold a conversation. He's okay to get up and walk away. Sometimes it takes him a few minutes to answer. But another quick update, I've contacted the Williams Cancer Clinic in California. I've already said that. In Vida in Arizona, they can't do anything till we get pathology back. So a gentleman who I work with, who owns a IV company as well, just happened to, I was asking him about his vitamin C protocol, how he works that. His wife has cancer as well. And he just kind of asked, like, what is your plan? Do you have a holistic doctor? And I said, well, this was my plan. And he goes, oh, we actually went to the Williams Clinic in California. And so he's already been there. He says it's been awesome. He gave me the protocol that they use there for the high dose vitamin C, so I can try that. He also gave me protocols on another medication that I won't mention on here. And so I will do that as well. I've got some labs to do on Brian before I do high dose vitamin C, just to make sure he doesn't have a specific gene mutation. Another thing that this gentleman told me was, I was asking him about another IV treatment, and he said that he was waiting for his genetic testing to come back, and he told me the name of it. So of course, because I'm a clinic, I called this place and I actually partnered with them today. They're sending me the box. What's super cool about this company is they do genetic testing. So I send in Brian's blood. They'll genetic test. They'll tell us exactly what mutation has caused his cancer. It will also tell us, which I think is super cool, I had no idea that it does that, but it will tell you what medications will actually work on that specific mutation, and if there is any drug trials in your area that you can get into for those mutations. So that was a win for me today. So I'm super excited about that. I should get it in the next couple days. Their team is going to reach out to me and talk to me about all the different testing and stuff. It also can go through insurance. However, even if my insurance doesn't pay, the answers that this is going to give me is going to be amazing. Yeah, so anyway, I'm trying to hire for my clinic. I'm trying to hire for my IV business. Please still be patient with me. We've got a lot going on, lots of people calling, lots of business I have to do. But thank you so much for those of you who have been so patient with me so far. I think I said I'd be in clinic tomorrow, so if you need to catch up with me. I know there was something else that I wanted to mention, and I might just have to wait, but again, I'm just so grateful, and I'm not tooting my own horn, but I'm so grateful that I have been led into the treatment that I have for people so that I can help my husband the best that I can. A lot of people are telling me I'm taking this really well. I cry. I cry. You know, nobody wants to lose their best friend. Especially not after we just were empty nesters. We like each other. We want to hang out together. And sometimes life throws you a curveball. And to be totally honest, I could sit there and mourn all day long based on his prognosis. But if I'm mourning every day, I'm not living with him for the time that he has left. And I just don't want to even think that, you know. I'm being realistic, but at the same time, I also want to look into anything that I possibly can to help him have the best quality of life for as long as he's here, or to be able to extend his life. So, so many people have reached out also to ask what they can do to help. And if I'm being truly honest, my business is going to be what allows me to get these extra treatments for Brian. These places require cash, and a lot of cash, and they don't take insurance. Just like I'm a functional wellness clinic, I don't take insurance either. So I would, for those of you who are asking what you can do, if you want, don't come and just get a service because, but if you know people or you yourself want services, please sign up at my business. We've got hair removal, we've got vitamin injections, we've got red light, we've got vibroacoustic meditation, we've got frequency healing, we've got massage and aromatherapy. I've got my Tesla Duet, which helps with stomach. I've got my Emcella. We sell Just Ingredients vitamins in our store. I've got all the new ones, everything. Come in and buy. You know, my hair removal is like so inexpensive. Come and get hair removal if that's what you want. There's just so many things that I offer, and this is going to allow me to be able to help my husband as much as possible. And of course, you can't put a dollar amount on someone's life. So no matter what, I will find that, but that would be the most help for me at this point in time. And I appreciate all of those who have already helped and reached out and just want to do stuff. And we will definitely reach out to you if we need you. Right now, I think we're doing okay. Anyway, so I'll make this kind of shorter than my last couple of videos. Thank you guys so much. I will keep you updated, keep texting. It really does help Brian feel better to know that people are thinking of him. I don't want him to get bored. I want him to work as much as possible if that's what he chooses to do with his time. And I know he loves hearing from you guys and your support. And we, again, feel your prayers. So at this point, please just continue to pray that I will be led in the direction that I need to be able to help him the best way I can. And so, anyway, thanks, guys. I hope you have a good night.